Hi, EULAR 2021. I'm Dr. Rachel Tate from West Palm Beach, Florida, reporting for RheumNow.com. The evidence-based recommendations from the Group for Research and Assessment of Psoriasis and Psoriatic Arthritis, better known as GRAPPA, were presented at EULAR 2021. The goal, as per the 2009 recommendations, was to develop recommendations based on the best scientific evidence and for the optimal treatment of psoriasis and patients with PsA. This was quoted from Dr. Laura Coates from Oxford, who detailed this in abstract number OP0229. So since the latest in 2015, there have been multiple changes, and I'm going to highlight these for you. So the new primary overarching principle is that treatment should be centered around patient-specific domains with an emphasis on shared decision-making with the patients. The comorbidity domains have now been split into two groups: related conditions, which now include uveitis and IBD, and of course, comorbidities. IL-17 inhibitors have strong recommendations in DMARD naive and IR peripheral arthritis, axial arthritis, enthesitis, dactylitis, psoriasis, and nail psoriasis patients. IL-23 inhibitors have strong recommendations in DMARD naive and IR peripheral arthritis, enthesitis, dactylitis, psoriasis, nailed psoriasis, and IBD patients. JAK inhibitors have strong recommendations in DMARD naive and IR peripheral arthritis, axial arthritis, enthesitis, dactylitis, and psoriasis patients. That's a mouthful. And new recommendations for TNF inhibitors, excluding etanercept, IL-12 and 23 inhibitors, IL-23 inhibitors, JAK inhibitors, and methotrexate in IBD patients, and TNF inhibitors, again excluding etanercept, and cyclosporin use for patients with uveitis. Recommendations against IL-6 inhibitors have been expanded. And then, of course, phosphodiesterase 4 recommendations have also expanded to include enthesitis, dactylitis, and nail psoriasis. So that was a lot of update for you. But this update also includes a position statement from GRAPPA based on biosimilars, detailing that biosimilars must be approved through a robust regulatory review. It also details that biomimics and intended copies are not the same as biosimilars. And this statement also requests that pharmacovigilance and periodic reevaluation to ensure quality for biosimilar products is important and necessary. And it reminds the audience that there were no biosimilar studies that were conducted in psoriatic arthritis patients, let alone regarding drug switches and immunogenicity. So, and as such, this data can be extrapolated in this patient population only. So there's also another new position statement regarding tapering and discontinuation of therapies. It basically revolves around the decision to taper, and that should be with your patients and through education. You want to highlight the benefits and, of course, the potential drawbacks when talking about this with patients. So as a reminder, GRAPPA experts are worldwide. Rheumatologists, dermatologists, and patient research partners, or PRPs. These recommendations are for adults who have psoriasis and psoriatic arthritis. These were done with systematic searches from Medline, Embase, and Cochrane Central. And these were conducted since 2015 guidelines until August of 2020, and the conference presentations in that timeframe between 2017 and 2020. Additional searches were completed for comorbidities and related conditions, and the methodology remains the same with the grade methodology. These allowed for PICO questions, which refine for each domain. So overall, this allows for treatment recommendations either to be for or against, with strong conditional or strong or conditional levels associated with each recommendation. So next steps will be to finalize all the comorbidities in the table and to present the data at the GRAPPA July 2021 meeting. Final GRAPPA recommendations, including the paper, and then of course the 8-domain paper with those groups, will subsequently be published later this year. So to see a visual of these guidelines, go to EULAR 2021 RheumNow website, and you can see my article that includes a visual graphic of these particular recommendations. So stay tuned to roomnow.com for more updates from EULAR 2021 and follow me on Twitter @UpToTate.